Hi, my name is Dr. Guy Citron. I'm the Chief Medical Officer for EndoAxis, where we'll be reviewing interesting cases, reviewing some difficult endocrine conditions, pointing some highlights. So we hope that you find this useful. We'll try to keep it short and sweet. So let me pull up our first case. Leah came to me with ovarian cyst rupturing. She's 39 years old, had a lot of weight gain, puffiness, PMS, fatigue, libido issues, irregular cycles, and length of her cycle was 32 to 34 days, very heavy flow, weight gain, significant PMS, and obviously, specifically for this case, ovarian cyst that would rupture and it would cause her to go to the hospital. I did a full workup analysis with blood work and with a Dutch test. And what I found in the blood work was that her serum testosterone was elevated at 77. Everything else was low, normal, estrogen, albumin, SHBG, free and bioavailable testosterone, progesterone, thyroid panel, lipids, A1C, everything. Everything else, LH, FSH, we tested, 5 days after ovulation. Everything was pretty much normal. So I was like, okay, so possibly PCOS, right? And in her Dutch analysis, the labs came back, lower DHEA, metabolites of testosterone were normal. She had what's called a UGT mutation. So if you're running the Dutch and you see that their total testosterone is very, very low, that's actually an accurate reading. It just can't be detected on the Dutch test, which is why I typically always refer to a serum value for testosterone, because sometimes there's this UGT mutation and it will be a little bit inaccurate. The metabolites are very accurate, so we can still get an assessment. However, the total testosterone might be false. Progesterone was normal. Her estrogens were all low or low normal. If you look at her metabolites, again, everything 16-OH is right in the middle. Her 4-OH is low, the 2-OH is low, 2-methoxy is low, her methylation activity is okay. So nothing really outstanding in this case that I was like, okay, this is what's going on with you. Her adrenal pattern, her cortisol graph, the graph itself looked normal. If you look at the right-hand side, all her cortisol was normal, creatine was normal. Her 24-hour free cortisol was on the upper end, which is normal. Metabolized cortisol is very low. There's nothing from this that I, could point to the exhaustion other than, she's metabolizing all the cortisol that she's producing. I ran the EndoAxis report and the sex hormone pattern showed that this pattern demonstrates likely PCOS with an elevated testosterone and irregular menstrual cycle. PCOS is typically a diagnosis of exclusion. It's like, okay, so this patient's slightly PCOS, but why does it, what's going on with everything else? In the findings section, which is the second page of the EndoAxis report, it points out very specific things to pay attention to. And in this case, it said that this patient has a higher preference for 16-OH versus 2-OH. So although their estrone and estradiol levels are not elevated, they report symptoms of estrogen excess. Specifically, this can, with a preference for 16-OH, this can result in ovarian and uterine cysts. So it was the first time that I saw anything in her workup that showed this is why she's having cysts. So I got very excited because I was like, okay, great, we have a potential reason. So the recommended supplements there were 3 supplements. And remember, for EndoAxis, all the supplements build on each other. So our recommendations all support each other. All the bottles support each other. They're foundational. So the first one is Harmonize, which is bottle 4. And this is a blend that helps with PMS and supports all aspects of menstrual health. I've been getting phenomenal results with PMS cases with Formula 4, and it improves regularity and quality of menstrual health all month long. It's 2 caps twice a day. Harmonize is the second blend that came up for Formula 10. It supports Formula 4, and it helps regulate androgen dominance while supporting fertility and ovulatory health. And then the last formula was Restore, which is Formula 11, and that's a targeted biliary and GI conjugation formula that binds estrogen metabolites through phase 3, meaning that it's going to bind to that 16-OH and reduces the risk for recirculation of estrogens. So I put her on all 3 formulations. That's 6 cap twice a day. Wasn't difficult for her. After 1 month of treatment, puffiness resolved. She started to lose weight very slowly. Energy went went up about 20–30%. Libido felt better overall. She originally reported a 3 out of 10. It went up to a 5 to 6 out of 10. No change to her cycle, except there was a little bit in terms of the length of the cycle, but it was a little less heavy. It was just heavy for one day. The rest felt moderate. No ovarian cysts, so we were very excited first month, and PMS was not as significant. So after month 1, I was like, okay, you're doing great. Stick to this protocol for 3 months. Let's check in 3 months. 3 months after she began treatment with me, puffiness completely resolved. She lost 7 pounds of weight. Her energy skyrocketed. She was an 8 to 9 out of 10. Originally, she was 5 to 6. Libido was almost full. She was 9 out of 10. Her cycle for the first time started to normalize. She went down to 29 days. Her flow was completely normal and no ovarian cyst ruptures. So for the first time, this patient was not going to the hospital. She was super excited. Everything came back to normal for her, and PMS completely resolved. So we hope you found this useful. We'll be sharing more and more case studies. Please know that we also have an amazing help center and educational center to help you guys through your difficult cases. Have a great week, and we'll talk soon.